Crucial facts about monkeypox. You need to know now. On August 14th, 2024, the World Health Organization declared the monkeypox a public health emergency of international concern. This is the WHO's highest global alert level, and the decision acknowledges the potential threat that the virus poses to countries worldwide. I've analyzed expert opinions to give you a clear understanding of monkeypox. In this video, I will present the symptoms of monkeypox, how it can be transmitted from one person to another, and how to prevent it. So, let's jump right in. The monkeypox virus was first identified in 1958 in laboratory monkeys, where it gets its name. However, it's more commonly found in rodents, like rats and squirrels, rather than monkeys. The first human case of monkeypox was recorded in 1970 in what is now the Democratic Republic of the Congo. First things first, let's talk about the early signs of monkeypox. The symptoms can sneak up on you, starting with a fever, chills, headache, muscle aches, swollen lymph nodes, cough, and a general feeling of being unwell. But the real giveaway? A rash that may be located on hands, feet, chest, face, or mouth, or near the genitals. The rash will go through several stages, including scabs, before healing. If you spot these symptoms, it's important to get medical advice as soon as possible. What about long-term effects? Most people recover fully from monkeypox within a few weeks. However, the rash can leave scars, and some people might experience complications like severe bacterial infection from skin lesions, monkeypox affecting the brain, encephalitis, heart, myocarditis, or lungs, pneumonia, and eye problems. Although most cases of monkeypox are not severe, some people may be more likely to get severely ill, including people with severely weakened immune systems, children younger than 1 year of age, people with a history of eczema, and people who are pregnant. The incubation period, which is the time between contracting the virus and the onset of symptoms, usually ranges from 3 to 21 days. A person infected with monkeypox can spread the virus to others from the moment symptoms begin until the rash has fully healed and a new layer of skin has formed. However, new research indicates that some people can transmit monkeypox to others from 1 to 4 days before symptoms appear. Now, how does monkeypox spread? It's not as easy to catch as some other viruses, but it can still spread from person to person through close contact. This includes touching the rash, scabs, saliva, or bodily fluids, or lesions around the anus, rectum, or vagina from a person with monkeypox. Respiratory droplets can also spread monkeypox, especially during prolonged face-to-face contact such as talking or breathing. Monkeypox virus can spread to anyone through contact with objects, fabrics, and surfaces that have not been disinfected after use by someone with monkeypox. So, it's important to be aware of how it spreads to protect yourself and others. Is monkeypox preventable? The good news is yes, it can be. Avoiding close contact with infected individuals and their belongings is key. Washing your hands frequently and using hand sanitizer can also help. If there's an outbreak in your area, being cautious and following public health advice is crucial. And if you've been exposed, early vaccination might help prevent the disease or lessen its severity. 2 doses of the monkeypox vaccine are given 4 weeks apart, and you will get the maximum protection 2 weeks after the second dose. No vaccine is 100% effective, but if someone who got both doses of the vaccine does get monkeypox, infections are usually much milder. Please check with your healthcare provider to find out if the monkeypox vaccine is recommended. However, vaccines might not be widely available everywhere, so prevention and awareness are still key. If you think you've been exposed to monkeypox, don't panic, but take action. Contact your healthcare provider immediately for advice. They might recommend getting the vaccine if it's available, or they might advise you to monitor your symptoms closely. Isolation might be necessary to prevent spreading the virus to others. Stay away from other people and avoid sharing things you have used or touched until you see a healthcare provider. Currently, testing is only recommended if you have a rash that resembles monkeypox. Your healthcare provider will advise you on whether you should be tested for monkeypox and can arrange for a test. The provider may collect a specimen and send it to a lab for testing, or they may refer you to a lab for both specimen collection and testing. How do you treat monkeypox? Right now, there's no specific cure, but treatment focuses on relieving symptoms and preventing complications. Most people with monkeypox recover fully within 2 to 4 weeks without medical treatment. Eat healthy, drink fluids, and get plenty of rest to allow your body to heal. Your healthcare provider may provide painkillers if required. The most important thing is to try to not touch or scratch the rash. If you accidentally touch the rash, wash your hands with soap and water. Avoid touching sensitive areas such as your eyes, nose, mouth, and genitals. Topical benzocaine or lidocaine gels can provide temporary relief. Topical creams like calamine lotion or petroleum jelly, as well as oral antihistamines like Benadryl, may alleviate itching symptoms. Soaking in a warm bath with over-the-counter bath products for itchy skin may help relieve the dry, itchy sensations associated with the rash. Antiviral medications may be used in severe cases. To prevent the rash from spreading to others or the environment, cover it with gauze or bandages. Do not pop or scratch the rash. This does not speed up recovery and may spread the virus to other parts of the body, increase the risk of spreading the virus to others, and potentially infect the open lesions with bacteria. If you have rashes on your hands, wear disposable gloves that are non-irritating when handling common objects or touching surfaces in shared spaces. Wear a well-fitting mask around other people until the rash and all other symptoms have resolved. If you have been diagnosed with monkeypox, notify your close contacts as soon as possible that they may have been exposed to monkeypox so they can monitor for signs and symptoms, get tested, and isolate if they do. They should consider getting vaccinated if they were exposed less than 14 days ago, preferably within 4 days. Vaccination is the most effective way to prevent or reduce the severity of the disease. By informing your close contacts that they may have been exposed to monkeypox, you're helping to protect them and those around them. You might be wondering, how is monkeypox different from other viral infections? Unlike the flu or COVID-19, monkeypox causes a distinctive rash that progresses in stages. While flu-like symptoms are common, the unique rash sets it apart. But in many mild cases of the monkeypox virus, the patients may show flu-like symptoms only. Monkeypox also tends to spread less easily than viruses like COVID-19, requiring closer contact. Could monkeypox become the next global pandemic? The WHO's classification of monkeypox as a public health emergency of international concern emphasizes the importance of addressing the disease's potential for rapid spread, particularly in populations with low immunity as a result of the discontinuation of smallpox vaccination programs. According to recent reports, the global monkeypox outbreak is still evolving, with cases reported in a variety of countries, including Europe and the Americas. The recent emergence of the more virulent clade orange strain of monkeypox raises serious concerns about the potential for a global pandemic. This strain, which has been linked to higher mortality rates and increased transmissibility, has already caused outbreaks in some countries, prompting the World Health Organization to declare a public health emergency of international concern. Some professionals claim monkeypox is not as readily transmissible as agents capable of causing a pandemic. Monkeypox is usually transmitted through close contact, including skin-to-skin contact and sexual contact, and even though it can be airborne, they claim it is not the main mode of spread. However, staying informed and prepared is always the best approach. We will also upload the updated information available on this virus. So don't forget to subscribe to this channel to gain more health knowledge so that you will be able to protect your loved ones. So, there you have it. Everything you need to know about monkeypox. If you found this video helpful, don't forget to like and share this video with your friends and family members so that they will also gain knowledge on monkeypox. Stay safe and see you in the next video.